Hello, I'm Anna Lu.
And I'm Daniela Barisano.
Today we'll be presenting on usage of needleless delivery device. As an overview, we'll be discussing what is a needleless delivery device, what FDA approvals of use there is in the US, the potential use of these devices in type 2 diabetes, the future prospects in type 2 diabetes, and a summary to conclude our presentation. So first, we'll be discussing what is a needleless delivery device. Based on the CDC, a jet injector is a medical device used for vaccination. It is a high-pressure, narrow stream of fluid that penetrates the skin without a needle. Jet injectors can be powered by compressed gas or spring. These were invented in the 1960s and were used successfully in mass vaccination efforts for smallpox and others.
Now that we know what a jet injector is, we will look at the limitations to traditional needle and syringe systems. This includes needle stick injuries, needle phobia, and the expensiveness and lack of reusability. Needle stick injuries are a serious risk to healthcare workers who administer vaccinations and manage sharps disposal. Among retail pharmacists alone, a National Institute for Occupational Safety and Health study reveals that the incidence of needle stick injury is up to 3.62 per 100,000 vaccinations administered. Traditional needle and syringe systems can be expensive in terms of it not being reusable and in the need of proper protocol for disposal. This technology is not only found to be beneficial for the pharma industry, but developing the world too find it highly useful in mass immunization programs by bypassing the chances of needle stick injuries and avoiding other complications, including those arising due to multiple use of the single needle. Considerations for the usage are the sterility, shelf life, and viscosity of the jug. It's important to note that technically superior needle-free injection systems are able to administer highly viscous drug products which cannot be administered by traditional needle and syringe systems, further adding to the usefulness of the technology for needleless devices. Person-to-person contamination is also a problem that must be addressed due to the reusability of the injectable needle-free devices.
Next, I'll be going into the FDA approvals of jet injectors. Looking at the FDA approval for jet injectors, the FDA approved of aflora influenza vaccine with PharmaJet's needle-free injector. PharmaJet's needle-free injector is called PharmaJet Stratus 0.5 milliliter needle-free injection system, which consists of a reusable injector that delivers a single dose with a disposable cartridge. No external power source is required. The device contains an adapter that can be used with vaccine vials. Based on data from a randomized controlled clinical trial, immune response to the 3 strains of influenza contained in aflora was no different when the vaccine was administered with the Stratus injector compared with traditional needle and syringe. Next, I'll be showing a video on how PharmaJet works.
This video is about PharmaJet's needle-free jet injection technology that can be used for delivery of liquid medicines and vaccines intradermally in a 0.1 milliliter volume. You will need the following materials for this Tropus educational video: PharmaJet Tropus injector, filling adapter, needle-free syringes, rubber ball, vial of non-sterile saline for injection into the ball. When you're done with this video, you should be able to properly prepare the injector, accurately fill the syringe, properly load the injector with the filled syringe, successfully administer the injection to the patient, and dispose of the used syringe. Step
So that kind of demonstrates how a needleless delivery device will work.
This video is
Looking at additional info from the CDC, flu vaccination with afluora quadrivalent via jet injector is approved for use in people aged 18 through 64. Afluora quadrivalent may also be given by needle and syringe for people 6 months old and older. As mentioned before, clinical trial data used in FDA's approval of jet injector demonstrated that vaccine using the jet injector method provided an non-inferior level of immune protection compared to the same flu vaccine administered via traditional flu shot. The most common side effects within this period were muscle pain, the feeling of discomfort or unease, like when you are first getting sick, and headache. Also, injection site reactions up to 7 days, such as tenderness, swelling, pain, redness, itching, and bruising.
We are now presenting type 2 diabetes mellitus because this population has frequent use of needles to inject insulin, yet many are non-adherent or have needle phobia. Using a needleless device can eliminate certain barriers, leading to increased adherence. So 150 to 200 million people worldwide are on insulin therapy. 1 in 10 Americans have diabetes, that's 32.4 million, and 1 in 3 Americans have prediabetes, which is 88 million. 30% of patients with type 2 diabetes mellitus are on insulin therapy for maintenance and control, and 23% to 77% are non-adherent to the insulin regimen. So insulin therapy may be required in type 2 diabetes for patients who are uncontrolled with their blood glucose level despite lifestyle and pharmacologic intervention. Some of the barriers to insulin adherence are system factors, medication factors, and patient barriers. System factors are inadequate follow-up and support. Medication factors can be regimen complexity, cost, and side effects. And patient barriers can be the fear of taking medications or health beliefs regarding medications. This chart here shows insulin adherence in patients with diabetes according to the risk factors for injection omission. So we see the injection site reaction has the biggest barrier to insulin adherence, followed by fear of hypoglycemia, injection being time consuming, interference with physical activity, and then lack of adequate injection instructions. The potential benefits for the needleless delivery device include the correct marks of hyperglycemia faster in overweight diabetic patients. In addition, when comparing needleless delivery devices to the pen injections, there was no difference in meeting the goal of the A1C, but there was a greater decline in patients using a needleless device.
Other potential benefits of a needleless delivery device in patients with diabetes are economic factors, needle technique factors, and adherence factors. In different health systems, with the absence of needles, there will be no needle disposal issues, therefore no use of personal needle prick accidents. In patients, there is no risk of needle prick accidents for other family members. It will be reusable and this device is portable. When looking at needle technique, a needleless injection device can include calibration for insulin dose. There is also a built-in lock release system which only releases insulin when skin contact is made, and there is pressure applied on the nozzle. Fear of injections can have huge implications on adherence. In a study, 11.8% of patients discontinue therapy due to dislike of injections. 28.6% associate insulin injections as painful or anxiety producing, and is associated with non-adherence and poor glycemic control. Next, I will be going into the future prospect of needleless delivery device in type 2 diabetes. Needleless delivery device used for diabetes are offered in a limited fashion in different areas of the world, but not in the US. There is limited information online about these devices and is not available in medical stores for purchase. Looking at the future prospects of a needleless delivery device being approved in use in patients with diabetes, we can see that the FDA approved a jet injector for influenza in 2014, so we hypothesize that with provider and patient interest, more studies and therefore more approvals for indications can come to market. As a way to raise awareness for this medical device, more research can be done and more push for companies with needleless injectors to come to the US. Through a search on FDA-approved needleless delivery devices, we found several different companies such as Biojet, PharmaJet, Inject, Biojector, VitaJet, PreciseJet, and more. To see a list of the approved jet injectors in the market, scan the QR code found on the slide.
And now we'll be going into our conclusions. To conclude this presentation, the usage of needleless delivery devices is underutilized in the United States. There is much more potential for the use of this device in patients for annual flu vaccination. A possible reason for the underutilization is the lack of pharmacies that carry a jet injector or the lack of public's demand for it. There is no information available for insurance coverage, possibly due to the slim interest in the device. There is a benefit in using a jet injector in certain populations, and providers and patients should weigh the pros and cons of the needleless device before using it. Going forward, if you find this topic interesting, we encourage you to do your own research on the needleless delivery device. You can also spread your knowledge and opinion after doing the research and assess your patients to see if they can benefit from this device.
Here are our references for this slide set. Thank you for your time. If anyone has any questions or comments, please feel free to contact either one of us at the email shown. Thank you.